Information for primary school staff. Tips on how to support a child with Prader-Willi syndrome in your classroom. This information is for primary schools who have a pupil with Prader-Willi syndrome or who have offered a placement to a child with PWS. It is a complex syndrome with a wide spectrum of effect, and you'll need to make significant adjustments to differentiate your teaching. However, with the right care and environment, as for all children, those with PWS can really thrive and start to develop their potential, and it can be very rewarding working with our children. PWS is a genetic disorder of chromosome 15. We know that several genes are involved, and researchers are getting close to identifying which genes are the actual cause of PWS. It is a lifelong and life-limiting condition with no known cure or treatment, and it's a relatively rare disorder estimated to affect about 2,000 people in the UK. In 95% of cases, it is a random accident of birth and not inherited. The syndrome occurs when there is either a deletion of part of the paternal chromosome, which is the most common cause, or by disomy, the child receiving two chromosome 15s from the mother, resulting in vital information from the father's chromosome not being expressed. There is also a much rarer inherited type. Researchers are beginning to identify differences between the deletion and disomy types, but both types feature the defining characteristics of PWS. For further information about genetics in PWS, visit our website at www.pwsa.co.uk. Whilst Prader-Willi syndrome brings many challenges, most people with PWS have many positive traits, as well as all the inherited and cultural traits of any human being. It can be easy to concentrate so much on the challenges of PWS that the positives become overlooked. If you differentiate your teaching appropriately and create a PWS safe environment within the school, you will find that you have a caring, humorous and happy addition to your class, with PWS being only a small part of who they are as individuals. Prader-Willi syndrome has some very distinctive characteristics. Many of these are caused by a dysfunction in the hypothalamus, a section of the brain which includes the pituitary gland and is responsible for the production of many of the body's essential hormones. Hypotonia can affect physical development, delaying both fine and gross motor skills and speech. The low muscle tone continues throughout life. Hyperphagia, or excessive appetite, is one of the more difficult aspects of the syndrome. It usually appears around the ages of 2 to 4, although it may be later. The child becomes increasingly interested in food and begins to develop a chronic, unrelenting appetite caused by messages from the stomach not reaching the brain. The range of intellectual ability in PWS is wide. While most have a mild to moderate learning disability, some have no learning disability at all, and a few have more severe learning disabilities. Immature social and emotional development generally becomes more evident once the child reaches secondary school age, but a lack of social skills and communication difficulties can be seen in primary age. There is a distinct set of behavioural characteristics which tend to go alongside PWS, and many children display autistic traits. However, it is important to remember that these behaviours are not learned and are a form of communication. Hypogonadism is usually obvious in boys from an early age, as they generally have smaller genitalia and undescended testes. It is present in girls but not so physically evident, and it's extremely rare for people with PWS to be able to have or father children. Many children also have very sticky or viscous saliva, which is evident in crusting at the side of the mouth. This can impact on the ability to chew and swallow, and also on speech. Some children may have an additional disorder and its accompanying behavioural challenges. These include, but are not limited to, autistic spectrum disorder, attention deficit disorder, dyspraxia, and speech and language disorders. If your pupil has an additional disorder, You'll need to factor in the needs of that as well as the needs of PWS. Low muscle tone will mean that a pupil with PWS is likely to have greater difficulty moving around the classroom and the school, and a risk assessment is usually required. They may be more unsteady when standing or walking, slower to move around the school, and less able to walk long distances. You'll need to take this into account and allow extra time for your pupil with PWS to get to other classrooms. Look at whether help will be needed carrying bags and how they're able to cope with steps and stairs. Most children with PWS will require differentiation during PE or other physical activities and very clear, simple instructions. This should be discussed with parents and their occupational therapist and should be addressed within their EHC plan. You'll need to be aware of additional trip or fall hazards within the classroom, in particular jostling from other pupils and bumping into each other. Safety within the playground needs to address the likelihood of being knocked over or bumped into without affecting their ability to socialise and join in with peers. Speech, language and communication. It is not uncommon for speech to be delayed even when other milestones have been reached. This means that some children will have a greater level of understanding than their speech would indicate. However, others may be quite articulate, but their comprehension levels are low, so be sure to check that information has been processed and understood. Various speech and language problems have been diagnosed in children with PWS. A speech and language therapist may be working with the pupil, and this can be checked in the EHC plan. Signing systems such as Makaton can be very helpful in easing frustration and aiding communication. The excessive appetite in children with PWS can be a relentless, overwhelming hunger, and depending on the age of your pupil, they may or may not have begun to display this. In some children it appears much later or to a lesser degree, so it's important to check with the parents. It is imperative to establish good communications with parents to ensure that measures are put in place when and if the child displays the desire to eat. Additionally, children with PWS have no feeling of being full, so the appetite is never relieved and they will not instinctively know when to stop eating. Unmonitored, they could continue to eat and food binge, leading to morbid obesity. Children with PWS also require far less calories than other children and must follow a very healthy, low-calorie diet which will be guided by their dietitian or other medical consultant. The child's weight will be monitored closely and the diet adjusted as required. Weight gain can be very rapid and very easy. It's essential that the child's dietary guidelines are followed precisely and that everyone working with the child respects and applies the measures in place. There is to be no deviation from this, and absolutely no food should be offered to your pupil with PWS without the prior agreement of parents or carer. Even if your pupil claims to have missed breakfast, always check with the parents first. One weak link can undo everything that everyone else is trying to do and will send mixed messages to the child, which can be very confusing to them. The excessive appetite associated with PWS means that children may food seek, food steal, and become very anxious and agitated if they're thinking about or fixating on food. It's really important to control the environment around your pupil to enable them to thrive. All food must be kept out of sight as much as possible, and it's advisable not to keep snacks in your handbag, briefcase or desk drawer. Never allow your pupil with PWS to be unsupervised around food. If you reduce the temptation, you reduce the levels of anxiety, enabling them to focus more on learning. All lunchboxes will need to be stored out of sight where your pupil cannot access them, preferably locked away. They will need to be accompanied when going to the toilet or walking to other parts of the school to reduce opportunities to access additional food. If food is provided, be mindful of how easy it may be for your pupil with PWS to take food from other children's plates. They'll need one-to-one supervision during lunchtime to avoid this, and food plates, once finished with, should be cleared away promptly. You will also need to review access to food bins and any food outlets. What happens at birthdays and outings? You'll need to ensure that if there are treats, that these can fit within your pupil's usual diet. Once again, it's essential to liaise with parents about the regime they would like you to put in place in these circumstances. Often, with pre-planning with the parents, it may be possible to give extra treats if your pupil is aware that they may have a little less to eat when they get home. Use alternatives such as fruit presented in a special way, rather than cakes or cookies. Do not use food as part of your teaching schemes. Think outside the box and don't use pizzas or cakes for teaching fractions. Avoid using raw food in messy or sensory play. All of these will remind your pupil about food and could create agitation and unnecessary anxiety. Many children love playing with play kitchens and pretend food, and it's important to check that they're not eating pretend food or food-like items such as Play-Doh. Always remember, even if your pupil doesn't actively seek food, it does not mean that they won't if given the opportunity. It's always advisable to put these measures in place even if your pupil is not yet showing food-seeking behaviours. There is a wide range of ability in PWS. Although the majority of children with the syndrome have mild to moderate learning disabilities, a significant minority have cognitive abilities approaching average and beyond. At the other end of the spectrum, some may have severe learning disabilities. Many have relatively good reading skills by the time they reach the end of their primary schooling, but may still struggle with mathematics. And in common with many other young children, those with PWS benefit hugely from visual reminders and prompts about activities. Processing information may be a little slower than in others, and they may need extra time to understand what you have said, or you may need to show them. Many children are very able at doing age-appropriate jigsaws and enjoy creative work. Although some may show characteristics of autism spectrum disorder, such as wanting to do things in a certain way, repetitive behaviour, or having a lack of social skills. This may be related to immature social and emotional development rather than true autism. But if this is suspected, professional advice should be sought. Children with PWS appear more socially and emotionally developed than they are. As their peers mature, those with PWS will tend to retain childish interests and preferences and lack the maturity of children the same age. Social time is more difficult and friendships hard to establish and maintain, so enlisting the support and help of other pupils will be important. Communication can be difficult for children with PWS, and the usual ways of communicating with very young children work well. It may be necessary for this to remain in place throughout their primary school life. Visual timetables broken down into morning and afternoon are often very helpful, as well as talking in a clear, simple and direct manner, and checking that the child really has understood what you say. They will often say they've understood whether they have or not. Use simple choice questions, and if a choice is required, give two options, not an open-ended question such as, "What would you like to do now?" Repetitive questioning or perseveration is often a stage which many young children go through, but those with PWS are likely to carry on doing this. Help them limit this by establishing a 3-question rule. Tell them gently that you've already answered and ask them to repeat back what the answer is, reassuring them that their facts are correct. If the answer to their question is genuinely "I don't know," you may need to explain why you don't know. Phrase your speech in a positive way. For example, say "Please shut the door" rather than "Don't leave the door open." A homeschool diary will help keep parents and yourselves informed of important activities or issues that may impact on your pupils' well-being. Not all children with PWS will display all of these behaviours, and it's important to understand that these behaviours are not learned, and the child is not just being naughty. Although it rarely presents as such, behaviour is a form of communication. Those commonly displayed are emotional outbursts and rages, which may occasionally become challenging. Obsessive or compulsive behaviour, and this can be related to people, objects or food. Manipulative behaviour, and some children may exhibit storytelling and fabrication. It's important to work closely with parents to ascertain if their child displays these behaviours, and if they do, always check what the child is telling you. A rigid method of thinking, often in terms of black and white, means the child with PWS can have difficulty processing instructions or switching attention from one subject to another. Once a fact is learned, it can be difficult for the child to unlearn it or to appreciate that it may not always apply. Skin picking is a known behaviour and difficult to control. It can be a result of boredom, anxiety, or just because there's a rough piece of skin or bite. The child's unlikely to feel pain from picking, and whilst covering the area helps, it may not stop it. Like most children, those with PWS work well when they can look forward to rewards for completing tasks or improving problematic behaviour. Smiley faces or star charts work well, and grown-up jobs work well as rewards. Do not use food as a reward under any circumstances. Be aware that the degree of learning disability does not relate to the severity of challenging behaviour. Almost every child with PWS presents with behaviours which can bring challenges to either themselves, those around them, or both. However, this varies considerably between individuals, and it's important to remember that these behaviours are part of the syndrome and have clear underlying causes. Feelings brought about by unrelenting hunger can be distressing and lead to behaviour changes. Many children also have specific emotional and learning disabilities, which can impact on behaviour. These may be evident even where the child is functioning at a relatively high intellectual level, and include difficulties in processing spoken information, as well as speech and language disorders, which can be frustrating for both the child and the listener. Children with PWS can go from happiness to anger or sadness in a very short time period, and this can be triggered by relatively trivial events, such as a change in temperature, an increase in noise levels, or a change to their diet or meal routine. Other factors include a chaotic environment, conflicts of opinion amongst those working with the pupil, and negative attitudes or hostility, whether this is hidden or obvious, on the part of the staff. Your pupil will be very sensitive to tones of voice and body language. Tiredness can be an issue for your pupil, and they may work better if a daytime nap is built into their timetable. A quiet corner works well if this is needed. It is sometimes possible to prevent an imminent outburst, especially if you have a good knowledge of your pupil's triggers or how their body language may change when it's about to occur. It may help to keep a record of any outbursts for the first few weeks of the placement and note what's happening around the child at the time. Here are some suggestions to prevent an outburst. Always use a calm tone of voice. Raising your voice or displaying annoyance will make the situation worse. Distract attention by doing something unexpected or humorous, or talk about a topic that you know the child loves. Offer praise for something the child has done well. Suggest a quiet place for a few minutes. Bring someone else in to take over, and remember the behaviour isn't personal, even if it is directed at you. Say as little as possible about what you think has triggered the behaviour. Strategies used for children with autism work really well for those with PWS. Make sure that you have a plan in place for what to do if an outburst occurs, and that all staff are aware and consistent in using it. the following guidelines are recommended. Remove the pupil or the audience from the situation if necessary. Take action to ensure their safety and the safety of others. Stay very calm, talk softly and as little as possible. Avoid eye contact. If possible, bring someone else in to take over if you are the object of the outburst. Don't attempt to reason or argue, even if the child is undoubtedly in the wrong. This will only prolong the outburst and cause it to increase. Although difficult, don't give in to their demands. If you do, they may learn that outbursts will get them what they want. Try distraction and humour again, and do your best to ignore the behaviour associated with the outburst. Allow your pupil to calm down in a quiet area and talk about it later in the day. However, don't expect them to be able to tell you exactly what caused the outburst. Children with PWS can become easily fixated on one member of staff, so if at all possible, use several different people to work with them at different times, but do ensure your pupil knows that you'll be doing this in advance. This strategy works well if one of the staff are unexpectedly sick or on holiday. Try to channel your pupil's behaviour into learning opportunities such as adding or subtracting, and use time spent doing preferred activities as a reward for good behaviour or completing a task, but do limit the time to 15 to 30 minutes. Due to the nature of PWS, difficulty in adapting to changes in routine can be a problem. However, the following strategies may help when these situations arise. Try to preempt likely changes where possible and prepare your pupil in advance. Try to help your pupil onto the next step by suggesting an activity they enjoy to do, but do take care with this particular one. Children with PWS may feel that they're being rewarded every time they act up. Keep very calm. Your pupil will be very sensitive to your tone of voice and body language. Try to be light-hearted. Be aware that your pupil has lost control of the situation and needs help to find their way back again. Only if it's safe to do so, ignore them and continue with what you are doing. Children with PWS usually have an incomplete sexual development. Boys may require surgery for undescended testes, and both boys and girls may not enter puberty. It may be necessary during PWSA lessons to tailor language in order to include the fact that some people start puberty very early or very late, some do not enter puberty without receiving hormone supplements, and not everyone is able to have children. It is vital that this information is passed to the school nurse and that all staff within the school setting are aware of the following risks. Many children with PWS have a high pain threshold and will not register pain. It is therefore very important that they're checked over thoroughly if they've had a fall, and if any problems are suspected, your pupil must be taken to the GP or A&E. Some children may also suffer diarrhoea or constipation without complaining of pain. A common feature in PWS is the lack of vomiting reflex caused by poor muscle tone, and this can mask the fact that they are seriously ill. It's important to find out from the parents if your pupil has a history of having vomited before, and if they vomit whilst in your care, you must inform the parents immediately. Some individuals have a base body temperature that's slightly lower than normal. It's important to know what your pupil's usual body temperature is and have a record of this. If it's usually lower than normal, a rise in temperature to slightly above average is equivalent to a high temperature in another child. Your pupil may also have difficulties in distinguishing if they're too hot or too cold. Easy bruising is another common feature of PWS. Due to the high pain threshold, your pupil may not be able to say how the bruise happened, and this is another reason to keep a record of any falls or bumps. As all children with PWS are different, check with parents about these risk factors, and you can find a list of these and other risk factors on the PWSA UK website. All children with PWS will have variable abilities, and it's important to gain as much information as possible from the parents of your pupil before they attend your school. These include: can the pupil grasp a pencil? Are some objects more difficult to grasp than others? Information about diet and the dietary regime, including exactly what your pupil is allowed for snacks and lunch. The more information you know about their diet, the better. Are there any additional physical difficulties such as scoliosis, a curvature of the spine, or difficulties relating to vision and hearing? Can your pupil tolerate touch, messy hands, or noise? Many children with PWS have acute hearing, and increases in noise may not be well tolerated. Difficult behaviour can often be triggered by certain words or actions. Parents will know what these are and can tell you what to avoid. Make sure the school has the contact details and any relevant information from key professionals involved with the pupil. How do parents feel PWS affects their child? Information in this presentation is a general overview, and the symptoms of PWS can vary considerably. Therefore, it's important to gain insight from parents as to how much they think their child is affected. It is vital to be familiar with the contents of the EHC plan. It is a legal document that must be adhered to. As previously mentioned, change is very difficult for a child with PWS, so moving to a new class, and especially a new school, needs careful preparation. It's important to start preparing your pupil about the move to a new class in plenty of time. Talk about the move, about the new teacher and the new classroom, and arrange for your pupil to meet their new teacher within the new classroom several times. It's also useful to provide parents with a picture board to use over the summer holidays. A comprehensive and thorough handover to the new teacher will help the transition phase and will prepare the new teacher for any pitfalls that they may come up against. Most young children with PWS start their school lives at mainstream primary with additional support, but there is a marked rise in attendance of special needs schools as age increases. When moving to secondary school, consider carefully, along with the parents, if the proposed school is appropriate and able to manage the challenges of PWS. At secondary school age, children with PWS will typically begin to fall behind their peers in terms of emotional maturity and development. Work closely with the parents to prepare your pupil for the change of environment and provide the new school with as much information as possible, including triggers which can cause upset, how your pupil deals with food, and all of the potential risk factors. PWSA UK is the only charity within the UK supporting those affected by PWS. Please help us to continue and educate your class about PWS by holding a No Treats for a Week fundraiser. Our easy-to-use pack provides all the tools you'll need to hold this easy and fun event, whilst also teaching some basic facts about healthy eating and Prader-Willi syndrome. The information can be downloaded directly from our website, or you can call our office on 01332 365 676 and speak to Karen. We hope you've enjoyed this presentation and found it useful, and we welcome your feedback if you feel it could be improved in any way. For more information, visit our website or contact us. We'll be pleased to help answer individual inquiries, and we also facilitate a teachers network consisting of an email circulation list for teachers of pupils of all ages to ask questions and to share experiences and good practice.